Question number 3. Hey, Dr. Islam, what are the pros and the cons of gastric bypass? So the pros, number 1, it works. Absolutely it works. We have very good research and information from quite some time actually that does show that gastric bypass does work, and you can lose up to at least 100 pounds, maybe 150, 200, depending on the type of bypass and what your goals are as well. Number 2 pro is that the risk of obesity, all those medical problems typically go away. So high blood pressure goes away, you can get off your medications. Diabetes typically go away, get off your medications. Heart disease may improve, get off your medications. Liver disease actually may improve and reverse, you can get off your medications for that as well. So the complications, the medical complications from obesity tend to go away. Number 3 is that your quality of life will get better. Absolutely it does. You can move, you can exercise, you can do the things that you could not do before, and this brings on a very incredible cycle of more weight loss, feeling better, losing more weight, more exercise, and it ends up being a reinforcing effect, and it does work for those individuals. However, there are some cons. Number 1 is that it's surgery. And surgery in and of itself has risk and benefits, because even in the best of hands, surgery sometimes do go wrong. Absolutely it does. And it's not anyone's fault, it's just the way it happens. And so there is a risk with going under the knife. Number 2 is that for a lot of our patients who undergo gastric bypass, they actually do have some significant problems that can occur with depression or anxiety. It is a dramatic change from what you were before to what you are after surgery in terms of how you look and how you may see yourself. And for some individuals, that change can bring on depression and anxiety as well. And there's a very documented evidence that sometimes the surgery can be very stressful on the mind for those individuals. Number 3 is that you can have other medical problems with this. Commonly, I see patients who have acid reflux, bad acid reflux, after a gastric bypass, which may be very difficult for us to control without medications or other surgeries because of the severity of the acid that they're having. And then lastly, very important, just because you have surgery doesn't necessarily guarantee you're going to lose the weight or maintain that weight loss. There are plenty of patients who have surgery who still gain the weight back. Absolutely. So the gastric bypass acts as kind of like a bumper road, a bumper car, where it kind of gives you the lane to go down, but people very calmly go off that lane and they go down their own path. And if they do that, they still may get the weight back than what they lost before. So let me know in the comments below, have you noticed anybody else have any pros or cons, or would you add anything to this list as well? But for the right individual, gastric bypass and gastric surgery works, it's effective, and it helps you to lose the weight and maintain that weight loss as well.